Hi, I'm Senator Jim Inhofe from Oklahoma. Over the last several weeks, many of you have inquired about President Obama's health care reform that has been making its way through Congress. Like most of you, I'm very concerned about proposals that would create a government-run program that's being referred to as a public option. Now, while I agree that our health care system needs reform that addresses increased medical costs and the many currently without health insurance, bringing socialized medicine to this country is not the answer. Now, President Obama and the Democrats are trying to rush this proposal through Congress before anyone has an opportunity to study the details, perhaps because they know that if the American public were given adequate time to really scrutinize the bill, they would be appalled. In addition to the fact that it would bring socialized health care to America, there are several other problems with the proposals currently being discussed. First, the Obama plan costs too much and does not adequately address rising health care costs or the uninsured. The legislation currently being discussed in Congress would increase the government debt by $30,000 per person. The nonpartisan Congressional Budget Office has estimated that the plan would cost well over $1 trillion. This is a tremendous amount of debt to pass on to our children and grandchildren. I know I have 20 children and grandchildren. I don't want them to incur this debt. The CBO has also estimated that millions of Americans that currently have health care coverage would lose their current coverage. It seems to me that this public option isn't much of an option at all. Furthermore, the CBO estimates that once fully implemented, the bill will still leave approximately 34 million people uninsured. Now, second, the Obama plan empowers Washington bureaucrats to make your health care decisions instead of you and your doctor. Let's consider for a moment the way in which the Cash for Clunkers program has been run. Within days, the program ran out of money. This is just the latest example of government inefficiency. Do you really want the same Washington bureaucrats that ran this flawed, ill-planned program also making your health care decisions? A good example of the problems created by the current proposal is how the public option would impact Medicare and health savings accounts. The public plan option would destroy Medicare Advantage and health savings accounts. Both these programs provide Americans of all ages with great choice for their health care needs. CBO estimates that 11 million people are enrolled in Medicare Advantage in 2009. That's now. American Health Plans, Insurance Plans says that the January 2009 census shows 8 million people are enrolled in HSAs, that's health savings accounts. That's a high deductible health plan. Third, the Obama plan would reduce the quality of health care in America. Even with all of the rhetoric out there touting this proposal as high quality, a recent New York Times CBS poll found that Americans are concerned that the proposal will reduce the quality of their health care, and 69% of those polled are even concerned that the quality of their own health care would decline if a government program is enacted. The people have caught on. Now, fourth, the Obama plan would result in long delays before medical treatment. We currently see these delays in other countries that have similar programs, such as Canada and Great Britain. You've heard all the stories about the cancer victims dying while waiting for treatment in countries like Canada and Great Britain, because many times the speed at which a patient receives care means the difference between life and death. Delayed care is essentially denied care. We cannot accept this in America. We should not forget that when President Obama was a senator, I was there, I saw this happen. He voted against a Senate amendment that would have allowed individuals to get health insurance from other states, thus creating more competition and choice in the healthcare market. Obama also voted against an amendment that would have provided for a deficit-neutral reserve fund. This would have provided an above-the-line federal income tax deduction for individuals purchasing health insurance outside the workplace. This would have helped those with employer-sponsored health care insurance to get coverage. As the Senate begins its August recess, I wanted to take a few moments to explain why I believe the current proposals are the wrong approach. Socialized medicine is not for America. Thank you.